Hey everybody, thank you so much for tuning in today. I have another video here with me, William Wallace, and my show, William Wallace for America. And as I like to tell people, you can find it on Facebook, YouTube, and on any podcast app. And the last name is spelled W-A-L-L-I-S. And as you guys know, I'm all about freedom and liberty, hence my name, which is my real name, by the way, of course, as I like to tell people. But you'll notice, sit behind us right now, which I'll be introducing in a second, you'll see lots of flags up there, and there's 3 of them, American flags, of course, that stand for freedom and liberty. And with me today is Jill Hines with ReOpen Louisiana, who's also about freedom and liberty. Jill, thank you so much for coming on the show today. I really appreciate it.
Thanks for having me.
So what's your other organization?
My other organization that I'm co-director of is Health Freedom Louisiana.
Health Freedom Louisiana.
Yes.
So let's talk about what ReOpen Louisiana is first, so people will know what your organization is and how they can find it.
Okay. So ReOpen Louisiana is a grassroots effort. We started it last spring. April 16th actually was our launch day, and it was an effort to reopen Louisiana. We knew even in April last year that the emergency was over.
Yeah.
We knew the gig was up. We knew the state needed to open it back up again so that the people could live. You know, the virus needed to die, but the people needed to live, and they needed to work, and to do that, the state needed to be open. So we started a grassroots effort called ReOpen Louisiana. We knew that there were some patriots in South Louisiana. I'm from North Louisiana, and we were just trying to coordinate our efforts. So we started a Facebook page called ReOpen Louisiana. We have a group called ReOpenLA, and we just tried to organize our efforts to protest, to have our voices heard. And then of course we heard that they could reopen the state with a petition.
Right.
You know, a majority of either the House or the Senate, all they had to do was sign a petition. So that's where we went gangbusters. We tried to get anybody to sign that petition so we could have a majority and open up the state in the public health emergency. We researched all the stuff about the federal funding, because that was an excuse we kept hearing from everybody, including the governor, that you would lose all this money. Well, you know, Pennsylvania was trying to do it at the same time, so I reached out to a senator in Pennsylvania and I said, okay, you guys I know have done your research because you've already got this in front of your Senate. Are you going to lose federal funding? He goes, no. We've already talked to, our congressman. You're not going to lose federal funding.
So you found a way to do it without losing federal funding, kind of a happy medium.
Yeah.
And being a freedom liberty guy like I am, I like to say, even though I know the elected officials and the powers that be wanted to do things safely, they wanted that, they're worried about, they're concerned about the people.
Yeah.
And I understand that, but also I understand that I think that there's a way without a knee-jerk reaction to do it. Now granted, given some people the benefit of the doubt, it's almost like we've never been here before, so they really didn't know. But because of people like you and your organization, you did the research and wanted to really inform people that, hey, we can do this safely in ways where we don't shut down businesses, we don't shut down our economy, and we don't shoot down people's freedoms and liberties.
Absolutely, because every action, whatever it is, has an equal and opposite reaction. So when you shut down the economy to preserve life, you're also going to be taking someone else's opportunity to preserve their lifelong business or something like that, to preserve their own life. The government doesn't have the right to tell you as a business owner that you cannot provide for your family. It's wrong. It was so wrong. And I kept seeing people would send me messages to our Facebook page. One business owner very early on sent me a picture of how she had to do the seating arrangements in her restaurant, and she literally had one table in there. And then she couldn't get employees because they were making so much more staying at home with the unemployment that the state and the feds were offering to them. So business owners were they were perishing. So granted, there were people dying from this, but there were also people that literally were losing their livelihoods. And we cannot force someone to starve,
exactly.
To preserve someone else's life. So it really motivated me to come down here. I made several trips over the summer, last summer, to come down here from Ruston and just asked, why aren't you signing the petition?
Right.
First of all, are you signing the petition? Because it was a big secret,
Right.
who was going to do it and who wasn't. And we just had to find out who was willing to do it, and if they weren't willing to do it, why weren't they willing to do it? And that federal funding was a big topic.
People were really worried about that.
They were.
I know there's some confusion on it.
Right.
There's some certainty on it, but the reality is, if instead of the knee-jerk reaction, people would just look at other things that can be done, with it. And here we are a year later, and people are kind of overdone, I guess, overburdened by it. We're tired of hearing about what could have been done, and it's slowly reopening, but yet I would like to think that the reason you're still doing this, I'm kind of saying it that way, of course, that it's almost in preparation if this ever does happen again.
It should never happen again.
That you're kind of still working hard to make sure that, hey, we're aware of the options. Now they're almost the end of it.
Right.
What would you say about that?
Well, they knew even back then. There was a scientist, I think in Canada, I'm not exactly sure where he is, Martin Koldorf, and he knew back then, and it kind of blossomed into the Great Barrington Declaration, is to preserve those people that we know that are susceptible to this. Protect the ones that are going to be harmed by it. Most not healthy individuals.
Exactly.
It's your elderly, those individuals with comorbidity. I mean, because the number one cofactor or comorbidity for COVID-19 is age. The median death age in the state of Louisiana is 76. So that means if you lined up the ages of all 10,000 people that have perished in our state, the middle number would be 76.
Right.
So
exactly.
Why are children? Why are we locking down children? Why are we preventing them from, enjoying their childhood?
Exactly.
When they're not going to be, for the most part, harmed by this.
And it's something I want to point out for our listeners on this video, and what I like about this is, some people, there's always going to be, as you said, it's always swings back and forth. There's always a pendulum swing here.
Right.
There's going to be a lot of people who go, that's those reopen Louisiana people. They're those bad conspiracy theorists or whatever. But the reality is, that I wouldn't say you're a conspiracy theorist.
No.
But the reality is that it's almost like we need some groups on the other side to bring out information, because even though you might not win Reopen Louisiana all the way, you might not win your battle, but the reality the fact that you're putting the information out there enlightens other people and helps maybe them do a little bit differently. I guess.
Well, I think part of our effort too was just to educate people on what the proper form of government is. What's the purpose of government? And did you know that our state's constitution actually outlines what the origin and purpose of government is?
Okay, what is it?
It's Article 1, Section 1 of the Louisiana State Constitution, rewritten, of course, by Woody Jenkins.
Oh, wow, okay, all right, okay.
But Article 1, Section 1, the origin and purpose of government is to protect the rights of the individual. I know.
To protect the rights and their freedoms. In parentheses, that means their freedoms and liberties, which you're protecting.
And so what I saw from the very beginning is that we took the opposite approach to that. We protected the rights of the community. They didn't want the community at large to be harmed by this. But whenever you work at in reverse, when you work at protecting the rights of the community or the collective, it's going to be at the expense of the rights of the individual.
Okay.
You can't do it without harming somebody's individual freedom.
Exactly.
So that was part of our endeavor, was to educate the legislators here. And this is another thing I found out. Every elected official in the state of Louisiana swears the same oath. From the governor to the police juries, they swear the same oath.
Okay.
And that is to protect and preserve the Constitution of the United States and the laws in the Constitution of this state.
Which, Article 1, Section 1, protect the rights of the individual.
Right. Nowhere in our state's Constitution does it say that the legislature or the governor is responsible for preventing me from catching a virus.
Okay.
But their job is to protect my rights.
And for those that might say, those Reopen Louisiana people are going to, help spread the virus or hurt the virus or whatever. It goes back to individual rights.
Right.
If somebody does not want to, if they're afraid of it, they can always
stay home.
They can always stay home.
Right. And
but
it's not just
when you shut down a business,
Yeah.
you know, we've shut down. I mean, granted, there's been grant programs and you know, grant programs, SBA loans, and other things that help businesses.
But look, we're helping businesses, but you and I are paying for it.
Right. Yeah, I'm glad you brought it because that's exactly what I was
Yes.
You stole my thunder, but I'm glad you did. That's okay.
But see, it goes back to when we're protecting the collective. It's at the expense of the rights of the individual. You cannot do it without infringing on someone's individual freedoms.
So on one point, while government has ended some businesses, they couldn't survive.
Yeah.
The businesses that borrowed the money, taxpayers are going to be paying that between those $1 trillion, the $1 trillion stimulus bills that have come out of this are going to be paid not even by us. Our grandchildren and our grandchildren.
Yes.
When it could have been avoided
Very much so.
with some of the information that you've got and you've had and you would try to get out there. And when people try to shut you down, you're just trying to get information out there.
I really am. And one of the things too that burdened me at the beginning of this was the responsibility that we placed on businesses to be disease mitigators. Like a small business owner, their responsibility is not to mitigate disease, unless of course they're unless they're providing food, right? Then they have a responsibility not to give me hepatitis A.
Right, exactly.
Right?
Yeah.
But for the most part, when I read the governor's original lockdown orders or executive orders way back when, the wording of it was he declared everybody's business a disaster area. It's almost like a tornado went through everybody's business. Everybody's business is a disaster area now. So he can control egress or going in and out of the business. And I thought, well, how can we have a disaster if you can't even see it? I mean, you can see the effects of it.
Exactly.
And then, like the hospitals and whatnot.
Almost an overreach of power.
Very much so.
Finding some obscure way to,
So they place this burden on business owners to eradicate disease. But where does that responsibility belong? On the individual. It's personal responsibility, just like personal freedom. You have a personal responsibility to take care of yourself, and we know that age is the number one comorbidity, but what are the other ones? You've got obesity, hypertension, anything that goes along with obesity, diabetes, all of those things. Where does that come into play? Personal responsibility.
Exactly.
So personal freedoms, personal responsibility.
So and what I like to say is, freedom is tough.
It is.
I mean, freedom is not easy.
No, look, you
and
I have had forefathers that have died for freedom. So it's not easy. It's not. And we shouldn't treat it as such.
Right.
Yeah.
And while freedom is not easy, it's almost you have to respect that freedom.
Yes.
And I guess grasp it in a way that when somebody wants to take it away, you guys say, wait a minute. There's and from what I picked up from you from talking is that you're not anti-governor, you're not anti-government.
Okay.
You're more you're more informed of what's going on and letting them know what happens. Now, granted, I get it. You might not like their policies, you might not like their actions, but I'm
not anti-government. I'm not an anarchist.
You're not an anarchist.
And we encountered a lot of anarchists at the very beginning. I was really surprised at people that were really very willing to overthrow the government. And I was like, wait a minute.
We're not
there yet.
That's not your organization.
That's not us.
Your organization is information and action and positive professional action, doing it in a way to inform people.
Absolutely.
You're not here, you're at the Capitol today, sitting in on committees with information, bringing people in that have information, and doing it in a positive way that works with our elected officials and not, tries to call them out.
Absolutely. We're all about educating not only the public at large, but also the legislators. Because just like you may not have known Article 1, Section 1, I don't think they had a clue about it, especially going into last March or April.
So let's talk about a couple of the bills that your group is working on, or not, I say working on, that you're working on it, you're being vocal about it, you're letting people know about it. What are some of those bills that you're working on?
Okay, so the one that I was here for today was HB House Bill 349, which was sponsored by Representative Kathy Edmonston. And HB 349 prevents the state from connecting the vaccine information that they already have. They track adult vaccinations as of 2019. So it prevents the state from connecting vaccine information that they have to your driver's license.
See, that, to me, that would violate HIPAA laws.
Right, well you would think that, but the legislation, this is where it gets a little tricky, the legislation they passed in 2019 said it's not under HIPAA. It's not, I can't remember the exact word for it, but it's not privileged, basically. So it's not something that HIPAA would cover. Now, the state tracks childhood immunizations, for school attendance and stuff, and that's actually covered under another federal law called FERPA. And off the top of my head, I can't remember what FERPA stands for. But it's not privileged information, so it's not something like, it even states in the law that if a state employee shares this information, they're not culpable for any damages for it. So it's not covered under HIPAA.
And that astounds me.
I know.
And I was there at the Senate committee meeting, so I'm kind of giving some things.
Yeah.
There was a gentleman, Claster Bernard, that got up and he spoke on, how minorities, blacks had, they had to have their papers to travel. It's kind of, this could lead, and again, there's going to be some people who go, oh, that's that wild thinking, but the reality is it's already in place. If it's connected, if a vaccine is connected to your driver's license, what's to say that a business or someplace says you have to show your driver's license and all that's scanned in when they scan in your information on whether you're vaccinated or not.
Exactly. And
it's almost like a vaccine passport.
Very much so. And that's one of the things that we're trying to inhibit is something along those lines because, like I mentioned in my testimony this afternoon, what all do you use your driver's license for? You use it to get a U.S. passport, right? You have to have your driver's license. You get it to apply for a job, to apply for a mortgage, to apply for an apartment, even to get a marriage license. So it's very concerning that any of those scenarios that you would pull out your driver's license for to gain entrance into a building or anything like that, that they could deny you if the appropriate information is not on there. And who deems it appropriate? All of that is so questionable. And some of the instances that I gave, one of the instances I gave was back in 2019 when we opposed that law originally for the state to track adult immunizations, was a policy that they have in Australia right now. It's called no jab, no pay. So that if you don't have what the country or the state considers the appropriate vaccinations for your children, they deny you a child tax credit. So my argument. That's a slippery slope. It's a slippery slope, and while there's so many people that want to think that it's crazy, it's that slippery slope that there's little things that could be done that can prevent people, discrimination because they didn't have a vaccine. And look, I want to point out, we had this conversation off camera, is that I'm not anti-vaccine, and I don't think you're anti-vaccine. My children are vaccinated.
Exactly. You don't like, and I don't like the idea of having it forced, or having to have it revealed, or I want privacy, and I want freedom.
It's just like any other medical procedure. It's private.
Yeah.
What other medical procedure are we going to share with everybody? So
we can't be pro-freedom and pro-government, pro-government at the same time, allowing government to,
Because that's a huge infringement, not only on rights to privacy, but your right to travel.
Exactly.
We are really fighting for the fact that we can actually leave our country and re-enter it at this point, because some countries like Israel has implemented a vaccine passport. It's going to be very difficult to get in and out of that country from now on. Now, granted, New York is not as crazy as that. They have implemented a vaccine passport in New York and also in California. But it's kind of insane too if you think about it, because it's going into private businesses. Like, you have to show your digital health pass to go into certain businesses, and that's terrifying. It really, really is, because who determines what's an appropriate medical history right here? And
I want to point out to the people that are like, I've met a lot of people that are, they're just, I cannot believe somebody would not get the vaccine. They push it, and I understand that. We're not talking about,
No.
we're
Get
not
it if you
talking.
want it.
Exactly. We're just
Yeah.
talking about you're being a watchdog
Yeah.
for freedom and liberty.
Yeah.
If somebody says, "Look, I want to be able to travel. I don't want to have the vaccine for whatever reason."
Right.
I mean, well, let's just paint a scenario that just came to my head.
Okay.
Imagine, if you will, that the driver's license vaccine went through. Okay, and you don't want to, and for whatever reason, let's say you have a medical reason that you can't get the vaccine.
Right.
And there are some, right?
There are many.
Okay, there's many.
Yes.
So it's on your driver's license that you don't have the vaccine. You go to another state, you try to get out, you're stuck.
You're discriminated
You're
against.
discriminated against.
Right, you're discriminated against and you're segregated against. And that's an excuse that we hear often. Well, you have to get this to protect the individuals that can't get it, for example. Well, what are we going to do with those individuals that can't get it? They're the ones that are going to not be permitted to come into businesses or out of the country or back into the country,
right,
because they couldn't physically get the vaccine. So that's another preservation of freedom right there, preservation of choice, and protecting, again, those most vulnerable because of their lack of their physical inability to get the vaccine, allergy, or most often it's allergies. There's a huge number of anaphylaxis. If anybody already has an existing blood disorder, my husband has a blood disorder, he's never going to get this.
Right.
So there's many, many reasons for people. And I want to just specify, whatever your reason is, it's valid.
Right.
And it's really none of my business. Right?
Exactly. So what's interesting is you're using, you're saying things that some people would think would be, the argument of one's political side, but you're sounding like somebody on another political side at the same time. But the balance is that it's about choice.
Right.
It's about having the freedom to make your own choice.
Right.
It's about liberty.
Right.
And while right now the conversation's about vaccines, when you support freedom and liberty on all choices, it gives everybody the right to make their own decisions on whatever it is. And you're not some, and look, let me say it like this, you're not some radical group trying to change things. You're just an organization that says, look, we want to make people more aware of what other options are in a way to still respect people's freedoms and liberties.
Absolutely. That's our underlying purpose, is to preserve and protect freedom. Our tagline is "Know your rights, protect your freedom."
No, oh, that's a good one.
Yeah.
So there's another bill that you're on too.
Oh, tomorrow. It's actually a House resolution, not quite a bill. House Resolution 20, again introduced by Representative Kathy Edmonston. And I think you're probably familiar with the little controversy over at the LSU School of Dentistry, where the dean sent out some communication saying, you can't go to graduation, you can't go, if you have to do patient care or anything like that, you can't do it unless you're vaccinated. Yeah. Well, and of course, you may be familiar too that Liberty Counsel, the large legal defense organization, stepped in and provided some corrective action for LSU, provided them with some federal and state laws that they were kind of violating. Well, HR 20 would provide informed consent for students in high schools, wherever they're going to be asking for children or students to be vaccinated, and colleges. So there's a federal guideline that allows an individual the right to refuse a drug under emergency use authorization. And there's also existing state statute that allows a person, for whatever reason, to object to a vaccine requirement for school attendance. Right. So HR 20, if there's any kind of communication from schools, whether it's elementary or higher ed or colleges or universities or whatever, if there's any communication about a COVID-19 vaccine, they have to be given the information that they have the right to refuse. I got it. So another thing I want to point out is that you're not trying to necessarily say no vaccines, no this. You're saying here are the options. Right. So in the future, there's not that knee-jerk reaction. Yes. And for the people that are worried and concerned about you're not trying to put people at risk to catch COVID. No. You're saying here are other options that people can explore to be able to protect your freedoms, protect your liberties, protect everybody else's choice, while at the same time
protect everybody medically,
Right.
because there are other options that you're making people aware of.
Absolutely. And one of our concerns too, we heard that after the dean's communication went out, there were dozens of students that went out and got vaccinated because they weren't aware. That violates not only the law, it's a violation of human rights too. The Nuremberg Code states, right, and because these drugs are still considered investigational, Nuremberg applies. But because everybody has the right to an informed consent. They have the right to know what's going into their body, and they have the right to say no, right?
Yeah.
So that human right was violated. They were coerced into believing that they could only continue with their education if they received that vaccine. Do you see how wrong?
Yes.
That's just so
I get it, yeah.
It's just so wrong. So HR 20 would eliminate that. It would provide students and parents, if it's going to be high schoolers, it would provide those people with the information that they have the right to refuse.
I get it. I understand that. And the good thing about this is there's nothing here that doesn't care about people. Or
Right.
You are just making people aware of other options,
Right.
and also in this case make an institution aware that
Right.
hey,
There's a law.
there's a law here.
Yep.
It might sound crazy, but
Yep.
again, it protects people's
Right.
choice.
Right.
And if if we don't protect it on this, it will
What's
just make it
next?
easier.
Right. What's
exactly.
next?
And it's also about stopping fear, because I
Yes.
think a lot of what's happened is there's the media created a fear.
Right.
Not that we don't need to have concern.
Right.
But it created a fear instead of concern.
Right.
And having a concern with good information like you're trying to get out there,
Yes.
basically just shows people other options and a way to stay calm but still protect people.
Absolutely. Information, in my mind, eliminates fear. And that unknown of what the government can do, it just creates a greater fear. So this eliminates or provides knowledge to help eliminate that fear.
So what's another one you're working on?
Okay, the biggie.
The biggie.
The biggie is HB 579.
Okay.
And that's introduced by Representative Beryl Amedee. And it recognizes, not creates, but it recognizes an individual's right to bodily autonomy. So we're not creating anything new. You and I have always had this right to bodily autonomy, that I cannot do anything to your body, you cannot do anything to mine without permission. The government cannot do anything to our bodies without permission. That's always been in existence, right? It's almost
well, it's always been understood.
Yeah.
I mean, I would say, the government doesn't have the right to touch my body.
Exactly.
Yeah.
This recognizes that and puts it into state statute, and actually offers a little bit of teeth to it with, I can't remember if it's a misdemeanor or a fine if the government infringes on it. So right now with our state's constitution, the government's origin and purpose is to protect
our
the rights,
freedoms and rights of the individual.
Well, there's no smacking on the back of the hand
Right.
if they don't do it, right?
Right.
So Beryl's bill, Representative Amedee's bill, actually incentivizes them to follow the law. I think if I'm not mistaken, there's a fine of some kind.
Right.
If they don't do it. So, but what it does is it just tells the government, no, you cannot plunge a needle into my arm.
Exactly. You cannot force me to have a vaccine.
Right, because if you remember, mid-summer last year, there was an interview with Alan Dershowitz, who's a professor emeritus at Harvard, very well-known attorney, and he made this very controversial statement that yes, the government does have the police power to take you and plunge a needle into your arm and force vaccinate you. And we were all like, whoa.
Yeah, wait a minute,
I know, right? I mean, he should know better. He
exactly.
should know better. And he had a nice little debate with several other attorneys, and they kind of corrected him on the errors of his ways. But once again, it caused a lot of fear because of what does the government have the authority to do? And so HB 579 literally just defines the rights of the individual to bodily autonomy and what the government can and cannot do in regards to our bodies.
That's actually very interesting, because you would think that we already have that right.
Yeah.
But again, it's that slippery slope.
Right.
And I want to point out that what I've witnessed is, the media, there's a fear about COVID. and not that we should not be concerned.
Right.
You know, not that we should not go, hey, look, I'm looking out for the elderly or the people that are most vulnerable.
Yeah.
But the fear's created, and then people have that knee-jerk reaction
Right.
that something has to be done. And in the midst of all that, freedoms and liberties get forgotten,
Right.
or walked on,
Right.
trampled on, or even just skirted to the side.
Right.
And your organization is just saying, look, we want to protect freedoms and liberties
Right.
in
No,
a
you're right.
professional way,
Mm-hmm.
in a way that is, you know, not
We're not confrontational.
not confrontational.
We will hold the occasional sign.
Yeah, a little sign,
But
right?
we're not going to shake it in your face.
You know,
or
I
anything,
like
but-
you hold the sign, but you won't shake it in the
No,
face.
or
Got
do
it?
that. Yeah, we're not we're not confrontational at all. We're very informative. I mean, we really do feel like it's our job to inform the public and our legislature, to educate them on what, you know, the state laws are, the
Right.
federal laws are, and also the human rights laws, the ethics that undergird human rights globally, not just here in our country, and why they're so important.
Right.
I mean, we're witnessing, in my mind, one of the worst human rights atrocities of our age.
Right.
You know,
Maybe we don't realize it.
Yeah,
Yeah, most people
yeah,
don't realize it
absolutely.
because they're afraid.
right? They're afraid.
Right.
They don't have they may have information from one source, but not from another. And I really think a balanced approach to information, the pros, the cons, one side versus the other side, gives a learner a better perspective on what the truth actually is. But if they're hearing the same constant information from one source, they're probably going to believe it. So it's very important to kind of instill the opposite view of that particular.
There's something that I say to a lot of the legislators when I'm interviewing them,
Uh-huh.
you know, is that some of them are very passionate about their bills.
Yeah.
And I understand that. I mean,
Yeah.
that's why they brought it forth.
Yeah.
And oftentimes they don't get the bill passed.
Yeah.
Sometimes it doesn't get out of committee. But because they made the information public and they made people aware that there's an issue,
Right.
they might not get their way now, but now the public's aware of what
Right.
else is out there.
Right.
So to that, using that analogy,
Yeah.
your organization may not convince everybody. It might even, to some people, seem like conspiracy theory,
Right.
or some people think it's crazy. But because you're a group that's not afraid to put other information out there,
Right.
people are now aware of not only other options, they're aware
Yes.
of, you know, hey, their radar's off that, hey, maybe this isn't a good thing for freedom or liberty.
Right, absolutely. And I think that it goes again back to the importance of knowing what your rights are. So many people just don't understand what your rights are. And I'm not going to be frustrated. I mean, it may take us 10 years. I have a friend that does the same thing that I do in a different state. And she just got a bill passed that she's been working on for 10 years. She's
Oh, wow.
introduced it for 10 years and she finally got it passed yesterday. Lots of celebration. It's basically the information that we're providing in HR 20, she got put into state law.
Oh, wow.
Yeah, just a person's right to refuse.
That's,
You would
Yeah.
think that we would just already have something
exactly.
like that.
Have a right to refuse, yeah.
But she finally got it put into state law in Iowa. I believe it was Iowa, after 10 years of trying.
Another way of pointing this out too to people, because I always like to show people on both sides,
Mm-hmm.
you know, and I don't, you know, but the pendulum, as we've talked about before, always swings.
Yes.
You know, it goes one way, it goes back the other way.
Yeah.
But with people like you putting out information,
Mm-hmm.
the people that want the pendulum over here don't want it over here.
Right.
Okay? But people like you in the middle
Yeah.
is helping it not swing so far to the left and so far to the right.
Right.
You're actually, some people might not agree with you, but it's information like yours that's kind of making a more balanced,
It has-
less of a swing
Yes.
either way.
We have to have a balanced approach to this because we've seen what a complete,
Shut
one-sided
down and everything, yeah.
We've seen the damage that can cause. So once again, it goes back to being fully informed and making a choice based on that information instead of just the information that's provided over here, which doesn't provide a balanced outcome. I mean, we've seen this.
Yeah.
So there's so many, 24,000 businesses across the state, I think, or something. It's not, that may be a large number. Maybe I'm thinking California.
But thousands have
Thousands
closed.
of businesses have closed. But so
People are out of work.
right. So this
Yeah.
approach has not been balanced
And
at all.
and what I want to point out too, you just made me think. I want to thank you for giving me this thought.
Okay.
Is that everything's opening back up a little bit right
Oh,
now.
yeah.
People are getting out there. There's businesses open, businesses start to pick back up.
Yeah.
But I want people to, so they're forgetting about where we've been.
Right.
They forgot about what the nightmare we've been through is, and what your information is say, hey, look, in the event this ever happens again,
don't do it.
We're going to be prepared, and this doesn't happen again.
Right.
So I have two more questions for you.
Okay.
So basically, so one is, how can people find you? How can people find your organization? How can people get involved? Or even if it's somebody on the other side that wants to get the other information, how can people find your organization?
We have a website. Health Freedom Louisiana has a website called healthfreedomla.org.
Okay.
Real simple. Find us on the web. We have tons of great information. We have a great blog post right now. Can we talk about masks?
Yeah.
Do you have a minute to talk about
masks?
Yeah,
we do that. That's fine.
So we have a project right now called the Smile Project, where we're trying to get masks off children in schools.
Okay.
Because just like you and I have a choice right now to wear one or not, there's a lot of people and a lot of adults.
A lot of wearing masks,
Right.
It's freedom.
Right. Well, our children don't have that choice. And they're literally being punished if they don't have their mask on. They have to have breathing breaks. They go outside to take off their mask and breathe outside. We don't do that as adults. Why are we forcing our children to do that? So we have a project called the Smile Project, where we have an open letter to our BESI board members, school superintendents, school board members. You can send it to them. Shows them some scientific data, probably stuff that they haven't seen, and some concerns that some scientists are raising about inhalation of nanoparticles from masks that may not have, that they have no safety standard, right? So that scientists are really raising some concerns about inhalation of nanoparticles long term. So we're sharing all of that with the BESI board members and trying to persuade them that the CDC may not be the be-all, end-all that they've said they. And plus, I think it was mentioned today in one of the committee meetings that the CDC is not an elected body. They were talking about a different board, but the CDC is the same lines. It's not an elected body. They're not elected by the citizens of Louisiana. Why are they telling us what to do?
Exactly.
Why are they telling? I get the freedom to tell them no,
right?
And so my children should have that choice too. They should have the.
Well, I want to point out too, and this is interesting, as you're talking about this, not to get real graphic, but I've seen kindergarten, first grade, second grade kids, and they might have Cheetos around their mouth, they might have dirty, grubby hands, and those masks have probably been on the ground, they probably... think about that. Again,
or on somebody else's face.
Yeah, exactly. This is the type of things we got to think about. The common sense stuff.
Right.
And it's not that we're anti-mask. It's not that we're anti-vaccine. It's just that we want you want a calmer, more balanced approach to it. Because if children have their mask, it comes off. Somebody else wears it, it's been on the ground, and to put a mask on, there's got to be some sort of a health concern,
absolutely.
For that.
And that's one of the reasons, traditionally.
So what you're working on now is a balanced approach to show people options.
And we've also implemented an OUT program, like a step-down program for schools.
Okay.
We want the parents to be the decision makers when it comes to masks, not the government.
Right.
We have already seen that the government doesn't make the best choices for our families, right?
Well, and you think about that, they're not. You got me excited because you made me think of another good point. Because remember, this is part of this podcast too. Is that sometimes when you say the government doesn't make a good choice, and there's people who are very concerned about the pandemic and very concerned about COVID, they go, well, they're protecting us. Well, guess what? They just passed a $2 trillion stimulus bill in the federal government that our children and grandchildren are going to have to be paying back.
Right.
And so if you can tell me they're making a great decision when less than 10% of that goes to help the pandemic, then this is the kind of information that we need.
Why are we trusting the government with our children's livelihoods, their
and
lives?
Futures.
And it's not just like their physical health. I'm hearing from people whose children are suffering greatly mentally because of the burden that we've placed on them. Once again, it's almost like we place the same burden that we place on small businesses, we've placed on children, and it does not belong on them. They're not responsible for disease mitigation. There's so many studies that show, and it's part of our Smile program, Smile Project, There's so many studies that show that children are not vectors of disease.
Right.
You're not going to catch they may be for flu.
Yeah, they may be vectors on other things,
but not this one. So why are we doing this to them? And I really think it's a stubbornness. Granted, too, they passed legislation last year that really made Bessie follow the CDC guidelines. And all we're asking Bessie to do is rebel a little bit.
Yeah.
Just let the parents make that decision. We've already seen how badly the government can make those decisions for us. It's time to and again, that's an encroachment on parental rights.
Right.
The government has literally taken away a parent's, it's a sacred right too, to choose what's best for our children. And they have determined what's best for our children. And it's not right.
And you know what's interesting is people, when they talk about the government, enforcement or government regulations, government encroaching, they think in terms of, let's just, I'm gonna bring in Second Amendment for a second.
Okay.
They think, oh no, the government's gonna come in and take away our guns, right? But I personally don't think that's gonna happen.
Right, I don't think so either, yeah.
But what is gonna happen in the meantime is they put the rules and regulations here and there, and it's little steps.
Right.
And while some people might think that's conspiratorial in itself, you can look at all the laws that are being created.
Oh my gosh, it's happened elsewhere.
Exactly, it's the same with this.
Right.
That, you're not saying that government is trying to force us, mandate, or infringe on our rights, but when you look at all the little bitty things that happen, it slowly, very minutely, over time, takes away freedoms and liberties and sets mandates, because imagine, if you will, they are allowed to connect our vaccination of COVID on the driver's license. That only makes it easier down the road for them to say, that's already being done.
Right.
We should also have this or that on the driver's license, and we lose privacy, we lose freedom, and imagine, if you will, that happening where we lose choice.
Right.
And if we're going to be about choice and freedom and liberty, we have to be aware of what's happening.
Absolutely. And I just want to point out one interesting little aspect of all the circle back that we're making to this driver's license thing. The slippery slope actually started in 2019 when they passed the legislation to track adult vaccinations. I mean, it started then. And our argument then.
This is even before COVID.
Before COVID, 2019.
Yeah.
Very, very close to COVID. Very, super coincidental. But they started tracking it, and our argument at the time was, you cannot, the government cannot take any information that they can use to incentivize, monetize, or weaponize against its citizenry. I mean, think about how much you can incentivize vaccination right now. Just less than a year and a half after that law was passed. We tried to tell them, I'm not a prophet. I'm really not a prophet. But I tried to tell them that was the step off of the slippery slope was them passing legislation to track adult immunizations.
It's interesting you say that too, because in a day and time of identity theft, and people, where people are hacking into our credit cards, sticking money, people are taking identities, that this is one more roadblock to be able to help prevent our personal information from being connected to a government website of some sort that may or may not get hacked into, especially when we see businesses all over the country, their websites, our information, their databases are getting hacked into. So imagine, if you will, the slippery slope where all the things get added on to our driver's license and it gets stolen or broken into.
Right, and it's just a breeding ground for discrimination and segregation. So I was so pleased.
That's a great point.
Yes, it really is. I mean, the opportunities abound for segregation and discrimination. So I was really pleased that
if we're going to be against segregation and discrimination, we got to be against it not just based on race, but
all
by information, by groups, by choices.
And another little interesting tidbit I learned when I was reading through our state's constitution is Article 1, Section 3, which prevents the government from discriminating against us for various reasons, age, sex, religion, and all that kind of stuff. But it literally states physical condition. What is our physical condition but our immune status?
Okay.
Literally, are we or are we not immune? So the government has already stated in their ethics outlined in the state's constitution that they cannot discriminate against us based on physical condition.
And that's another great point. Imagine, if you will,
Yeah.
you're limited to where you can go based on whether you have a vaccine.
Right.
It's on record. It's on public information. They got it on your driver's license. Imagine, if you will, hey, look, if you, and I'm making this up, but for the purpose of explanation and understanding.
You don't have to make anything up these days.
Yeah, because it's
it's going to happen.
Well, look, not only that, but I'll say this. Do you know 2 years ago, there was legislation in our state house legislation to regulate deer pee?
No,
So
don't doubt it.
So you're right. Nothing is to the imagination.
No.
So back to my analogy, imagine, if you will, you say, somebody says there should be something that you can't park in a handicap zone unless you're handicapped.
Right.
And you're going to have to, but if it's on your driver's license, you're going to be protected.
Right.
Or you'll have access, you'll have better access into wherever. Now that sounds like a well-intentioned, good thing.
Yeah.
Give handicapped people more access to things. However, what if that same credential is later used against them? They say, well, hey, handicapped people cannot go here
right.
because they might fall off the cliff.
Right. They prohibit entrance.
They prohibit
discriminate.
entrance because there's not access here.
Yeah.
It becomes a tool
Right. For discrimination. And
that could be
segregation.
used by somebody who doesn't like that group of people.
Right. Exactly.
So it works both ways. So
really
while
does.
it might sound crazy
Yeah.
in some ways, it's just something that you're trying to make people aware
right.
of.
The opportunities,
The opportunities
are
are there. And some people are going to say that's just crazy talk.
No,
But
not
if people like yourself protect it now or
Yes.
make it available or aware now,
Right.
it can prevent it down the road from happening either way.
Absolutely.
The pendulum swings.
Absolutely. Always will.
Exactly.
So yeah, that was our purpose, is to prevent. It's a prohibitive type bill. We see it coming. Like I said, I'm not a prophet.
Yeah,
but I saw it
not
coming.
trying to be a prophet, yeah.
But I saw it in 2019 when they started tracking our immunizations, and the opportunity is there. So we just need to stop it.
Awesome. So it's groups like yours that's making it aware, Reopen Louisiana,
And Health Freedom Louisiana.
and Health Freedom Louisiana. And what does
Yes.
Health Freedom Louisiana do?
Our purpose is to educate the public and legislators on your rights.
Okay.
Your rights to choose, your rights to refuse.
I like that.
Yeah.
Health freedom, your right to choose, your right to refuse.
Yeah.
And again, it's another way to protect freedoms and liberties.
Absolutely. Absolutely.
Wow. Well, Jill, is there any parting words that you want to tell people, how they get a hold of you? Or
Well, for the time being, you can find us on Facebook and other social media platforms. We're on just about all of them. Telegram, I think, is another more popular one. Twitter, a little bit. But Facebook doesn't like us so much. That's another one of Beryl Amade's bills that I really appreciate, is her social media platforms, because our Reopen Louisiana Facebook page was doing extremely well several months ago. Our analytics said that we were reaching 1.4 million people across the state. But then I shared pictures, not full faces, but just pictures of children's mouths with impetigo from wearing masks.
Oh, that's right. Impetigo is something with the mask. That's
huge.
bad, right?
Yeah. So they hit our Facebook page with a warning, and it dropped our viewership down to like thousands. From 1.4 million, we're slowly getting our way back up. I got a notification today that we're up to about 53,000. But when we were at 1.4 million back in like September, October, and then you get hit like that. So Representative Amade's Social Media Free Speech Act is very appealing to me, because Health Freedom Louisiana is an LLC. If our business is impacted by the fact that Facebook doesn't want people to see our business, we can't monetize it. Not that we do. None of us take a salary or anything like that. We're all volunteers. But still, it's very difficult to raise funds for printing literature and stuff like that, for raising gas funds for me to get my 7-hour round trip from Ruston. So I love the idea that her bill, while Facebook is, a private business and whatnot, it's considered a free
market. Again, it's their freedom.
It's their freedom.
Yeah.
But it has become so influential, and it's basically considered a public marketplace. or public square.
Square, right.
So when they impact my business because they don't like what I say, it really does impact our free speech and our freedom to do commerce.
But and I make this point before we let everybody go,
Yeah.
is that with your information you're putting out there, if more people would just take a calmer look
Yes.
at the other options,
Yes.
and instead of the knee-jerk reaction
Right.
and the media frenzy of scare
Yes.
and fear, then companies like Facebook or other social media platforms may not feel like they have to
Right.
threaten or react on this,
Right.
and then it becomes more of a shared information,
Right.
and more of a promotion and a coming together on freedom and liberty.
Oh, absolutely.
And everybody be able to make their own choices for how they want to live their lives.
Absolutely. I wish Facebook embraced free speech. I mean, you would think that a platform that embodies speech would embrace freedom of it, but they don't. It's terribly sad to see that. But
well, let's keep that on our eyes, in our
Yes,
eyes,
yes.
and on our minds, and let's keep this information on there. I'll ask one more time. Any parting words for the group?
Sure, yeah. Find us on Facebook while we last. Other social media platforms, I think, will embrace us more so than Facebook. Reach out to us through our our website too to get on our email list.
Okay.
So we can keep you informed. I've sent out several emails to be at the Capitol. We have a great guest speaker that's coming to testify for Beryl Amade's bill next week, her bodily autonomy bill.
Okay.
Mary Holland, who is
Oh, wow.
the president and CEO of Children's Health Defense, is coming to testify on her behalf. So get on our email list or our website, healthfreedomla.org.
Awesome. Jill, thank you so much. I appreciate you coming on.
Sure.
Everybody else, please share the video, talk about the video, share the information, but also most importantly, tell people about the platform so they can go and see more of it. And again, the pendulum swings, so it's about finding information to share so everybody else can make their personal choices about our freedoms and liberties. Thank you so much, and everyone have a great day.